premier tool in America that's been in place for about the last 50 years or more is called the Framingham Risk Index. And what the Framingham Risk Model does is combines a patient's age with their risk factors for heart disease, such as high blood pressure or high cholesterol or being overweight, smoking, etc., and then places that patient in one of four risk categories, from very low risk to very high risk of having a heart attack or dying from coronary disease. Unfortunately, the Framingham Risk Index is very good at identifying patients at very low risk for a heart-related event and at very high risk. But unfortunately, it has weaknesses at identifying patients who fall into what we call intermediate risk, that middle range. Those patients are often misdiagnosed by this predictive model alone. To make matters worse, about 2/3 of the American adult population falls into intermediate risk. So there's a very large population of patients, as we'll see coming up on a future slide, that are underserved or even misinformed by Framingham alone. And that's the population that we really want to consider and bring themselves for coronary calcium scoring. That's what all the guidelines suggest, is the intermediate risk patient population. I always like to address the issue of radiation, because anything with a CT scanner these days, appropriately so, should be evaluated for patient safety and radiation exposure. This is a very, very low radiation exposure test. The measurement of radiation is a term called millisieverts. It's 1 millisievert of radiation. To make a comparison, that's almost the exact same radiation involved with a mammography test, and less radiation than you would pick up in the air on a flight across the United States. So very low dose, very patient safe, patient friendly test.